Hello, everybody. Happy Monday. Today's lecture is about healthcare delivery system. This is our new unit. So you're probably asking, what is this? Well, I can tell you that it's basically how we deliver healthcare to people. The major general way we do this is a hospital. Okay. So 10% of all jobs in America are in healthcare. More than 200 different health careers out there. A lot of us are moving towards wellness model, prevention disease. The average life expectancy in the United States, 79 if you round up. Where do we rank in the world? 48th. Womp womp. Who is first? Not us, but Japan, 85. That's pretty good. After this is all done and said, those numbers might be a little bit further down. So hospitals, obviously the major type of healthcare facility everyone is accustomed to. There's a lot of ranges and a lot of services that they will actually perform for people, and a lot of ways that they get money: private, religious, nonprofit, voluntary, government, just depending on income. Are there any hospitals you are scared of? Well, everyone's heard bad stories about Grady, but Grady is a trauma hospital, so that's why you hear them. And I honestly would be scared of any hospital right now. Don't go to the hospital at all unless you think you are dying or have the it disease. Specialty hospitals, these are for age groups, grouping patients with, I don't know, cancer, pediatric, psychiatric rehabilitation. What are some examples in Georgia? We got a huge one you should think about right now. Children's, you probably go there already. And if you're going to try to be a pediatrician, you definitely got to know your stuff to be able to work there. Cancer Treatment Centers of America, they're all over the country. Arkham Asylum is not real. That's a Batman joke. All right, government hospitals. So some examples: veteran hospitals, psychiatric hospitals, rehabilitation centers. Do you know what the difference is between Fed and state? Well, FBI is federal while your local sheriff is state. Obviously, the FBI has more jurisdiction than the local sheriff, okay? And why are some of the vets so homeless? Well, unfortunately, PTSD is a horrible disorder, post-traumatic stress disorder that affects them. And then you look at the percentages that I'm showing you too, 70% have substance abuse problems. So not only PTSD, but maybe some kind of alcohol, opioid, other drug, substance abuse. 50% also have serious mental illness. 68% are in principal cities. So not only do they have a lot of issues, but they are mostly in our large cities like Atlanta. It's pretty sad that some of these hospitals don't have the best funding, and we're not caring for the people that protected our country as well as they deserve. University or college medical centers. Every college has something like this on it, which you should take full advantage of. CBC, that's a complete blood something test. I don't know if that's the count. That's what it is. Flu testing, strep testing, finger stick glucose, pregnancy testing, HIV testing, STD screenings. Well, I don't need to go in detail about the last three because y'all know what happens in college, okay? Why are there different types of hospitals, or what are they? General, specialty, government, and university. These are the four categories they go into. Long-term care facilities mainly care for elderly patients, and they can be broken up into three different types: residential care, extended care, and assisted living facilities, okay? Residential and assisted, there are basically letting the person do their own thing. They might provide housekeeping, meals, basic physical care, but honestly, they're not really getting a whole lot of healthcare care. An extended care or skilled nursing facility is where your insurance is paying for the skilled nursing care and rehabilitation services. So I'd always have to ask our surgeon when someone came in to get a brace because they were hurt or broken a foot, things like that. I'd have to ask them if they were living in an extended care facility. Reason why is if Medicare is paying for that facility, they want the brace to come from that facility. They don't want a different practice clinic to bill for that brace as well, and basically paying for two types of services that can accomplish the same thing. So I have to ask somebody where were they living without trying to insult them, because they would give me that face that old woman's giving me right now. I assume you're living at home, is that correct? If they are living at home, great, I'm right. If you're not living at home, oh, I guess I'm wrong. Could you please tell me where you live? That's the way you got out of it. Communication is huge in healthcare. Medical and dental offices, they vary from one small doctor to large complex with multiple specialties and other healthcare professionals. Resurgent Orthopedics is a great example of this. It's a huge orthopedic practice. Can you guess how many doctors are at Resurgence? 100 plus. When I was there, it was below 100, and they had 21 locations all over Georgia. They continue to grow every day. They are very, very specialized in orthopedic evaluation. So if you ever have an orthopedic issue, they got plenty of people there that check you out, and they specialize in different joints and parts of the body. Northside is really good as well. I don't know those doctors as well, but I'm hearing great things. I just know all the Resurgent docs very well. Clinics or satellite centers. This is where doctors from different practices can share a facility. Surgical centers, they come in one day, they have surgery, they leave, and it's not like the hospital or the practice. Urgent or emergency care centers, rehabilitation clinics, you name it. I want to ask y'all, do you know when to go to the emergency room versus urgent care? When, why, and what for? Well, emergency room is going to be for anybody that thinks they're dying. Urgent care, don't go there if you think you're dying. Go straight to the emergency room, because urgent care is just going to tell you to go to the emergency room. Urgent care is great if you need medicine. Right then and there, a prescription. You know you're sick, you just need some antibiotics, you need a shot. That's what urgent care can do for you. If you go to urgent care for something that you're not really that concerned about, they're going to refer you to a specialist, and you're going to be paying two copays. My copay when I went to urgent care to get just an ultrasound done was $75. Okay, just think about paying that and then another one somewhere else. So you think you're dying, emergency room, urgent care, go get some medicine. All right, what do you call a physician who specializes in eyes? Well, you got two of them, ophthalmologist and optometrist. Those are hard to say. Oof. What's the difference? Well, an optometrist can diagnose vision issues, examine eyes, prescribe lenses. They're usually going to be people at lens crafters that you see. Ophthalmologists handle everything optometrists can, but also perform surgery and is technically an actual medical doctor, although I think they both deserve the credit and I think they both should be considered doctors. Emergency care services. These can be private and governmental. Ambulances can be dispatched from fire departments, hospitals, even helicopter emergency services. Now, as a healthcare professional, I always like to try to save some money. If I don't have to send them in an ambulance to the ER because they're not dying or they can be fixed some other way, I will always do that to save them a penny. Even if you broke your arm, doesn't mean you need to go to the ER. So when I can evaluate someone and kind of figure it out, I like to, because this is how expensive they are. An ambulance ride is up to $1,200. A helicopter ride is $12,000 to $25,000. That's almost like a surgery, from carpal tunnel all the way to an ACL surgery. So that's kind of scary. So I always try to save people money if I can. Laboratories, often part of other facilities, but can be their own. They do diagnostic testing, blood and urine. Speaking of blood, I didn't ever tell y'all how much blood actually costs. One pint sells for $130 to $300. O-neg is probably more expensive, but in this time of need, obviously, I'm very glad that we had 2 blood drives this year at North Forsyth, because they are asking for blood as much as they can, and they're not getting as many people because of social distancing. A lot of blood drives are getting shut down because of this, and so I'm thankful that at North we tried to collect as much blood as we could before this pandemic hit us. Home health care, well, this was more common in the late 1980s, and now is a lot of growth. This is where people can go to homes to provide therapy that's physical, speech, respiratory, even do other things like food prep, cleaning, and household tasks. You might think that that sounds like a maid. Well, it's not. They are doing things that other people cannot physically do. It's not like you're having these people come over to your house because you're fully able-bodied. It's because you can't do those things, and that's why they are helping with prep, cleaning, and household tasks. In Latin America, we all had maids just because it was a lot cheaper and we were able to give someone a job. But we were also able-bodied, so obviously that wasn't running through insurance, okay? Hospice, well, you guys know what this is already. It's basically making the person as pain-free and their life as meaningful as possible as they're on their deathbed. They're not looking for a cure. This is just to make people very comfortable. Okay. What would be at the top of your bucket list if you were on this? Well, I'll tell you mine. I would participate in as many food challenges as I could. If you've never seen the show Man vs. Food, it's terrific. It is living out my second dream job opposed to this one. After I eat all that food, I would take the best nap ever. I'm pretty good at taking naps right now while we're on quarantine. I think I take one every other day, and it's fantastic. Mental health services, well, these can be anywhere from counseling centers to psychiatric clinics. Typically, you're going to see some kind of abuse, physical, child abuse, spouse abuse, elderly abuse. And although they do treat mental disorders and other diseases, we shouldn't be looking at people like this. We should be looking at people like this. Everybody needs help, every single person, including you. Genetic counseling centers, well, these are new and they're doing a lot more prenatal tests. And what are they looking for? Genetic abnormalities. Some examples, cystic fibrosis and Down syndrome. Cystic fibrosis is a disease that affects the mucus lining within somebody's lungs. The life expectancy used to be 30. That was like a death sentence when you hit 30. Now they're in the 40s and 50s. I know somebody who just had her 35th birthday and has this. So a lot of innovations have occurred in this field. Rehab facilities, these can be physical, occupational, speech, and hearing. And what is occupational therapy? Well, if you have an occupation or a job, you might need to get therapy on how to work. So things as how you set your desk, how you lift people. If you're at school, what things would you do? You know me, I have a standing desk. I might need to change that. Simple things that we do every single day that someone else might need help with. That's what occupational therapy is. You might not think it's necessary or it might be a little funny to you, but literally, someone might need help going to the bathroom after an injury, okay? HMOs, this is a health maintenance organization. So typically, this is kind of like an insurance as well, where it deals with a lot of preventative care, all right? What issues could there be with this though? You need to see physicians in their specific network. They have their own facilities. Services might not be covered if you're out of their network, and you have to get a referral to see a specialist. So as long as it's not like an emergency or an acute injury that happens suddenly, it works. It could save you money. They have lower premiums, less money to pay each year, but your level of service and how quick you get your service might not be the best, okay? Industrial healthcare centers, these are found at large companies and industries. They do emergency services, examinations, accident prevention, and safety. Do they do therapy there, like physical therapy? Yes. Lots of factories, as you can see, might have injuries. These people are using a forklift to lift something else. You know accidents are going to happen and someone's going to need rehab. So in these industrial settings, they have athletic trainers and physical therapists on site to actually help people. Delta, I know someone that was in class at GCSU with me as athletic trainer who is working at Delta doing physical therapy right now. Think about the people that have to work outside, have to lift heavy things. They have an on-site physical therapy clinic where they treat the employees there before work or after work or during work. I hope y'all enjoyed this. I will talk to y'all tomorrow. Peace.